Hey guys, it's Dr. Ben. Wanted to hop on here quick and discuss a really important topic that a lot of people are dealing with, and a lot of times patients or prospective patients have questions on. And that situation is where they are dealing with injury, and then the pain goes away for one way or another, one reason or another. It's due to it could just be randomly the pain goes away, or they stop doing the activities they love, or they stop exercising. They just rest altogether, and the pain goes away. And a lot of times people think that they're out of the woods, all right? And don't want to be the bearer of bad news, but majority of the times, this isn't the case where they're out of the woods. A lot of times this will come back. Majority of times this comes back. And why is that? Why does it mean that you're not out of the woods just because the pain goes away? So I've got my screen pulled up here. And this is something that we go through with all our patients on the first visit, discussing like what the Prokinetics process is. And I'm not going to go through the entirety of this, but I think it's really important to start showing you guys the reason. This helps explain the reason why just because you're out of pain doesn't mean that you're out of the woods. Okay, so we have a three-step process that we use. So phase one is we want to obviously decrease the pain and discomfort. Phase two is we really want to address the root issue. Okay, and then phase three is making sure that we body-proof the entire body and get you up Mountain Dew more. So you're back to exercising, you're back to doing all the activities you love, and most importantly, have a bulletproof body, not just in the sense that if you came with a knee injury, making sure that the knee injury doesn't come back, but also making sure that a shoulder injury doesn't pop up, or ankle injury, low back issue pops up and gets in the way of you exercising, running, doing yoga, hiking, strength training, you name it. We want to make sure that the entire body is bulletproof. But today I want to focus primarily just on phase one and phase two and kind of the branches between that. Okay. So before I dive into that, you guys might be wondering, like, well, why is it that the pain goes away, but it doesn't necessarily mean that the issue's resolved? And the reason for that is because when we rest, the inflammation decreases, and inflammation causes pain. Okay, so a lot of times when people start going back to activities that they took a rest from, the inflammation is going to come back. And the reason for that is because the root issue hasn't been addressed, and that's what we do in phase two of the rehabilitation process here at Prokinetics. Okay, a lot of times when you go see a practitioner, a chiropractor, physical therapist, massage therapist, main thing is everything's really focused around pain relief, which is great. That's something that we definitely touch on. But at Prokinetics, we want to take it a step further. We really want to address the root issue so you get long-term relief and long-term solutions. Okay, because a lot of times if you just go to pain relief, a lot of times that pain just comes back if you're not addressing the root issue. Okay, so I want to show you guys the reason for that. So what we have here is a little diagram here where we have symptoms and pain, and then also signs, and then we also have imbalances here and thresholds. So you guys might be wondering, what does all this mean? So when somebody comes and sees us or decides to give us a call and think about doing physical therapy with us, they're in this part where they're having some pain or discomfort, not able to do the things that they love. And a lot of times what happens is during that first phase of PT, we're trying to get them to this threshold. Okay, this threshold is where the part where you started having pain initially. Okay, but the thing is, this didn't just happen randomly. This injury or this pain that you're experiencing, or the pain that patients are experiencing, happened due to years, sometimes decades, compound effects of years or decades, months, you name it, of imbalances that have developed due to poor movement mechanics, poor mechanics throughout the day with everyday life, or just the way that your body is. Those things can develop over time. Okay, and so you might have had signs that have been there for a long period of time, but never resulted in pain. So, for example, you might notice that your running feels off, or one leg feels longer than the other, or you feel like you're more stiff throughout the day, or if you're doing squats, you shift your hips to one side versus the other. Those are signs, but it doesn't necessarily mean that there's pain. So what happens is when you don't do anything about those signs or the muscle imbalances or mechanics there, what happens is over time, you're gonna creep closer and closer to this threshold. This threshold is the part where you start having pain. So a lot of times patients, when they're working with us, they're usually out of almost all their pain and have their pain relief within the first 2 or 3 visits. But that doesn't mean that we're done yet, okay? Because what happens is during those first few visits, we reach this threshold, okay? And we get to this point where they're not having pain anymore. However, we haven't addressed these signs or these underlying imbalances yet. Okay, so it doesn't take the moment that they're out of pain. Okay, if they're only out of pain for a day or two, they're probably just past this threshold. It's not going to take much to get them pushed back to this threshold. Okay, so phase 2 is really removing these signs and symptoms, or aka fixing the root issue. Okay, so how do you fix the root issue? By doing a detailed assessment to first figure out where the imbalances are and where they're coming from. Okay, and then after that, we address it through strengthening, stretching, changing the way that you're moving, your movement mechanics, how you're squatting, how you're running, looking at your analysis of whatever exercise or activity that you're trying to do, and correct that. Okay, and then from there, phase 3, we get to bulletproofing the body and working on performance so that you're not just back to where you were, but you're past that and you're performing at a higher level. So you're running faster, you're running further, you're biking further, you're lifting heavier, you're lifting longer, you name it. That's what phase 3 is. Okay, but I wanted to pop on here and talk about why, again, don't want to be the bearer of bad news, but we see it all the time where patients will call and they set up an appointment, and then we usually have a week or two wait list, and so they're scheduled 2 weeks out, and sometimes patients will call and be like, hey, I'm feeling a lot better, I'm not having pain, I'm going to hold off on doing the evaluation. And then what happens is that pain comes back usually within a week or two, definitely within that first month, and they're back on the schedule. And now the signs and underlying imbalances have progressed even further. So now their program with us is even longer because now the imbalances have had more time to set in. And so big thing is if you're going through these fluctuations of pain on and off, on again, and the pain goes away, doesn't mean you're out of the woods. Still, we got those signs and those imbalances that led up to the issue in the first place. Okay, so don't always let pain be your guide in with regards to how further along you are in the process with regards to issues actually fixed. Okay, so hopefully this gives you guys an insight on the importance of really diving into the root and fixing the root issue. That's what our big focus on is, fixing the root issue and getting you back to a higher level of performance. So if you guys have any questions, just reach out, and we're here to help. All right, thanks guys.